Good morning, everyone. I will be talking to you guys about the Dominican Republic, and I'll be mainly focusing on the health of the Dominican Republic, some diseases in the Dominican Republic, and also just the well-being of the population in the country as well. So I want to start off by just explaining some basics about the country. So the capital is Santo Domingo. This is located next to Haiti, so they're neighboring countries. They lay like this on the map. The population is 10.3 million, and just to give you a kind of comparison, the United States is 328.3 million people. So this is a much smaller country compared to the United States, and I want you to keep that number in your mind because when I'm giving you facts and statistics about diseases, they may seem like, oh, that's not a lot of people, but for a country that's already really small, they are. So ethnicity is 70% Indio, 15% black, and 13.5% white. And what Indio is, it's a mix of skin color and ancestry. The main language is Spanish spoken. The religion is Roman Catholic, but that doesn't mean everyone's Roman Catholic. And then the government system is a presidential republic. So what this means is it's basically a democracy just like the United States, and the residents will vote on a president, and then that president has people under them, and that's kind of how the laws and regulations go into effect. So the disease burden. So a number and disease that was shocking to me was tuberculosis. It had a big morbidity and mortality rate in this country. Now, the fantastic thing is it has lowered tremendously over the past couple years. So in 2018, there were 3.7 to 6.1 thousand people estimated to have TB in the Dominican Republic. Now, the mortality rate has dropped tremendously with tuberculosis, and this is due to surveillance and having a report system to have better accurate numbers for TB. Now, the mortality rate as of 2020 is 2.8 deaths to every 100,000 people diagnosed with TB, which is amazing. It has lowered tremendously. The way they're doing this is they're treating TB cases a lot more accurately now with medication that will actually target the TB. The main problem, though, is that a lot of people in the Dominican Republic also have HIV, and as we all know, HIV and TB do not go well together. And it is found that about 25% of people that have HIV in the Dominican also have TB. So 1/4 of the HIV population is estimated to have tuberculosis. So that is now what their focus is gearing on, because those are the people that are now dying. That's the mortality rate. So I looked at the top causes of death in the Dominican Republic. So number 1 is heart disease. Number 2 is intracerebral hemorrhage. 3 is Alzheimer's disease. 4 is ischemic stroke. And 5 is HIV/AIDS. So you can even see now that in the top 5, tuberculosis isn't even one, which is great. What really shocked me is that a lot of the causes of death in the Dominican Republic are also our top causes of death in the United States. Heart disease and stroke are in our top 5. So it shows you that even developing countries still are having the same problems that developed countries are also focusing on. So then I looked into HIV/AIDS because this isn't something that the United States is. We're focusing on it, but it's not our main cause of death right now. So HIV has about 70,000 cases in the Dominican Republic. Remember that the population is only 10.3 million. So this is a good amount of people that have this in such a small country. And about 38,168 people are getting the ART therapy. The other people are not being treated for their HIV either by choice or just not being diagnosed, or they're just not being consistent with their therapy. The main age groups this is targeting is 15 to 49 years. So it's getting the younger populations that are having the HIV issues. So we need to just focus on getting them the treatment to get this HIV number decreased so it's not one of the leading causes of death. So then I looked into maternal mortality rates, and in the Dominican Republic there are about 95 deaths per 100,000 births, which is not that bad. It's rated kind of in the middle right now. So looking at maternal mortality, the United States has about 19 deaths per 100,000 births. And the lowest country is Poland. It has about 2 deaths per 100,000 births. And South Sudan is the worst with 1,150 deaths per 1,000 births, which is actually very shocking and very scary. But so the Dominican's kind of in between right now, which is kind of expected for a developing country. And then I looked at infant mortality rate, which is 20.9 deaths per 1,000 births. And again, the Dominican is kind of in that middle range of not doing great, but they're not doing awful. The United States was rated 5.3 deaths per 1,000 births. And then the top country in this was Slovenia with 1.70 deaths per 1,000 births. And then Afghanistan was the worst at 104.30 deaths per 1,000 births. So again, you have to think in this case that the United States is a developed country. It has the healthcare, it has the advances, and the Dominican Republic is behind on that. So then I looked again at life expectancy, and this kind of plays into that developing versus developed country. So females are at 77 years in the Dominican, and males are estimated to live about 71 years. And this is lower than the United States, as you all know. The United States is about 76 to 81 years. So you have to think, well, we're dying of the same things, basically. So it has to be the technology that we have, the research that we have, the healthcare system that we have, and that's kind of why it's a little bit lower, and the medications that we also have. And it's just a different world, even though we're not that far apart in, hours from a plane. So then I kind of stepped away from morbidity and mortality and looked at the health and nutrition, because some of these factors, like heart disease and stroke, may be related to nutrition. So I looked at the obesity rate, and in the Dominican Republic, it's 27.6% of the population is obese, which is actually lower than the United States, who is at 36.2%. So then I thought, okay, well, I wonder how many children are underweight. So looking at 5 years underweight, the Dominican Republic is rated 4% of the population is underweight if they're under 5 years old, which is kind of, again, in that middle range. But for a population that has a 19% poverty rate, 4% is not the worst that it could possibly be. And that poverty rate has also continued to decrease each year. So I compared it to the United States, and the United States is actually the best in having the lowest number of underweight children. It only has 0.5% of the population. So for such a major population, that is great for us as the United States. But we're also developed. We have a lot of nutrition, we have a lot of resources, and we have a lot of programs for the poverty population in our country. So then I was thinking, okay, well, let me look into breastfeeding and see, who is getting the proper nutrition that way. And as we know, breastfeeding, the main children don't get those antibodies, so we need breastfeeding to help fight infections, since until 6 months of age they don't really have a good immune system. And the breastfeeding rate for that first breastfeeding time with the colostrum is 38%. And then looking at how many breastfeed in the 0 to 5 months, it's 5%. Breastfeeding in 20 to 23 months is 12%. So the breastfeeding rates are very low, which is scary because this is a country that does have infections and does have mosquitoes and does have poverty areas. So breastfeeding could help these babies fight those infections better. And part of the reason is just they're not educated on this information. And another thing is culture. We play a lot of well, what did your parent do? And then what did their parent do? And that's kind of how we go off of it. So if my mom didn't breastfeed and then the next mom didn't breastfeed, that's how we're basing this if there isn't new education being taught to them. So a major preventative measure for a global health nurse or a nurse in the Dominican Republic would be to educate and change that culture if they would be willing. But I also wanted to look at diabetes, and diabetes is kind of in that average range for the population, and they're at a lower rate than the blacks and Hispanics in the United States. So I wanted to look at their food intake, and the Dominican Republic is receiving more fruits than many other global countries. And then I looked, okay, well, if they're receiving fruits, what is the nutrition that is causing maybe some of these diabetes incidents? And the salt and saturated fats are towards the maximum amount that you're supposed to be consuming. So that's part of the problem. And then I looked at the sweet and sugared beverages in the country, and they are way over the standards you're supposed to be consuming. And globally, this is a problem because it looked like almost every country was way over the sweet and sugared beverages that we should be consuming. So this kind of gives you a perspective of how a developing country versus a developed country is. We have so many similarities in so many different ways that you wouldn't even think, because you're like, oh, they're underdeveloped or they're developing. But in many ways we're similar, and in many ways what we're doing in the United States is affecting them, and that's how they're getting technology, that's how they're getting research and advancements for their treatment. So I hope that you enjoyed this, and I look forward to hearing your discussions and comments. Thank you.